Hi everyone, I'm Dr. Gillian Wilson and I'm a clinical psychologist and resident consultant at Be Balanced Educational Resources and Be Balanced BU. So today I'm going to explore the area of sleep and in particular how to avoid the very common bedtime battle with a parent who's having difficulty trying to get their 8-year-old daughter to bed every night. So I'm sure this is probably something that a lot of you either experience or have experienced with children growing up. So the first thing I would say when a parent asks me about a child who's having difficulties with their sleep is whether it's what we would call an acute problem or a chronic problem. So an acute difficulty is something where a child has been able to get to sleep and where their sleep has been reasonably settled, and then this is a new thing that has happened, so it's a change. A chronic sleep difficulty would be where the child has had difficulty with sleeping over a prolonged period of time. And I suppose why this is important is that how we would support parents would be very different depending on which category it would fall into. So, a child who has an acute difficulty with their sleep, often the sleep problem is actually secondary to something else that's happening. So, the poor sleep is a symptom of perhaps anxiety or something else. A child who has always had difficulties with their sleep, then it can be more to do with their sleep patterns and their sleep habits. So, so that's the first thing I would say is thinking which of those categories it would fall into. The next thing is trying to pinpoint exactly where the difficulty is. So, is the difficulty getting the young person to settle to sleep at night and getting over to sleep? Or is it that they're waking a lot during the night? Or is it that they're getting up out of bed during the night? Or that they're getting up very early in the morning? Um, as I'm sure you know, as parents and as adults, very often we can go to bed at the right time, get up the right time the next morning, but still have a very unsettled and broken quality of sleep. So there's a lot of information about in terms of sleep and how to help with that. But what I'm going to do is, suppose, thinking about with for this parent in particular, it sounds very much that the difficulty really is around supporting the young person to settle in bed at night when they're going to bed. Um, so, as I was saying, if it's an acute problem, so if, say, with this child had been a good sleeper and had gone to bed and settled to bed reasonably easily over a period of time, and then this is a new thing that has started. What I would say is to really look at what else might be happening for that child in their life. So, how's school? Are they struggling with their schoolwork or having difficulty with their peers? Are they perhaps getting bullied? Um, are there things happening outside school? Is there exam pressure? Are there maybe worries in the family that the child's picking up on? Are there changes coming up, like moving to post primary education? So, what else may be going on? So, the sleep really is an indication that there's something that the child is struggling with. Another thing that can be an indicator of that is if there are other things that you're noticing, such as the young person maybe isn't eating as well as they normally do, so they seem to have kind of gone off their food a bit. They're maybe bringing their packed lunch home and they haven't eaten as much of it, or they just seem a bit quieter and a bit more withdrawn. So, certainly, where you're seeing a number of indicators like that, to me, would be suggesting that there's something else that you need to explore. So in that case, then it's really looking at targeting. If it is, say, that the young person's very anxious about something, it's addressing that and providing tools to help with the anxiety, and the sleep then should settle itself. So, assuming in this situation that this has been more of a long standing difficulty with getting the young person to sleep, then that can take more time to change because it can become quite an established pattern over time. So, in terms of actually going to bed, again, I would think of these difficulties falling within two different kind of areas. One is, what is it that is making the young person want to stay up and stay awake and stay doing things? Or what is it that they're avoiding going to bed for? So, is it that they don't want to go to bed because they don't want to either be in the bed or the bedroom or go to sleep? Or is it that they want to be up doing other things? So, in terms of staying up, it could be that they're not tired. It could be that they want to be on PlayStation or watching their iPad. Another thing with younger children is they can get quite anxious about separating from their parents, and maybe going to bed in a bedroom on their own, and they want to stay with mum or dad. So looking to see if any of those are factors, and then in terms of not wanting to go to bed, there can be a number of reasons why children just don't want to go to sleep, and don't want to go to their own bed. So it may be that they're anxious or scared of having a wedding accident. It may be that they're scared of the dark. And with younger children, this is a very, very normal a very normal thing for children to experience. They may be having nightmares, or there could be other reasons that they don't want to go to sleep. Um, Sometimes when there's maybe with young children when there's been a bereavement, and sometimes they hear people saying about that a pet or a person has gone to sleep. Sometimes as adults we don't realise the language we use. Some children can take very literally, and some of the children I've seen in the past, this has actually been a fear that children have had, that they thought going to sleep can be connected maybe with a family member or somebody who's passed away. So it's trying to have conversation with your child if there are fears there about going to sleep, what they may be. There's a lot of practical things in terms of just having a really good regular sleep routine at night. So start really after tea time, trying to help the young person to wind down, having a story at night, having a bath at night with maybe some relaxing essential oils to help their body physically wind down. Thinking about what they're reading before night. So if you're doing a story with them and it's a child maybe who's a bit anxious, you don't want to be doing a story that has a lot of action in it. It's about a relaxing, soothing story. At a practical level, things like night lights can be really helpful for a child who is scared of the dark. And again, your sleep hygiene stuff like not having screen time before bed, not maybe drinking just before bed. If it's a child who would have wedding accidents, then that reduces the likelihood that that's going to happen. Other things that I find are quite helpful are the sprays, the sleep sprays. So sometimes people say to me, "Oh, I tried that and it didn't work." It's not so much the actual smell of the spray. So some sprays can have essential oils in them, maybe like lavender, which can be associated with helping you to relax. But one of the things with the sleep spray is that our brain starts to pair the smell of the spray with getting ready to go to sleep. So after a while, when you smell that, your brain automatically goes, right, it's time for bed, it's time for sleep. So it's getting a really good routine set up so that your child knows that they're building up to bedtime. Putting things in place like your sleep spray and your bath that's helping the child's body to relax. Thinking, is there anything that may be causing anxiety, such as a fear of the dark, and thinking about things that like night lights that would help with that. And having a look on the internet, there's lots of things, lots of really helpful advice out there with things just to help with helping your child relax. And it's being really patient, because when a child has had difficulties for a long time with sleep, it's not going to just change overnight. On average, I would say to aim for, if your child's going to bed very late, trying to pull that forward only maybe by about 15 minutes once a week, once a fortnight. So it is going to take time to do. Um, but hopefully some of those suggestions maybe will help. The other thing is, I would say, is if you are concerned, if this is a new thing that's happened with your child, and you are concerned that there are other indicators there, like I've mentioned, maybe they're not eating as well, they seem very withdrawn, they're tired. If there are a number of indicators and you maybe try some strategies and they're not making any difference, then check in with your GP, because there can sometimes be underlying medical reasons as well why a child's sleep pattern can change. So it's always worth checking that out. But hopefully some of those tips might help some of you, and I'll be back next week with another question from another parent. Thank you.